Please, can you introduce yourself for us?
Okay, I am Dr. Utibe Adurayemi. I am an optometrist, a primary eye care practitioner. I find pleasure in talking about the eyes. I'm so passionate about the vision of photographers.
Today, we are talking about the eye of a photographer. We're going to be talking about the things that they do that silently damage their eye, and the things that they actually know they do that silently damage their eye. I've heard of migraines, severe migraines that actually move to the eye directly. In general, what can you say first before we start pulling out the questions for you?
Most photographers perform their duties outdoor. They have outdoor shots sometimes, and then most of the time they're exposed to UV rays, harmful sunlight, and then they don't know that it's actually harmful for their eyes in the long run. So our advice that photographers get a pair of lenses to help trap the harmful sunlight. Also, they make use of their gadgets, their screens, when they are doing picture editing. And then prolonged exposure to the screen light is also harmful to the eye in the long run. Part of the diseases, more like that, part of the diseases that prolonged exposure to blue light from the screen can cause is what we call macular degeneration. There's a part of the eye called the macula, situated in the retina.
Okay.
The macula is more like the seat of vision. You know, every machine has an engine house. If the engine is not there, the machine cannot perform adequately. So more like the macula is the seat of vision. Without the macula, you can't see clearly. And then the blue light goes straight to the macula and, damages it in the long run. Most times, they start having early macular degeneration and all of that. It can also lead to photophobia, sensitivity to light, and even eye strain. So blue light too can also damage the eye in the long run. And also, they work without resting. Most times it's good to limit screen time after a period of time. Excessive exposure to the screen can cause a lot. There's a hormone in the body called melatonin. It's a sleep hormone. So if you expose yourself to the screen too, it can actually suppress the hormone. I don't know whether any photographer has observed that when they do prolonged screen time, they don't really sleep well at night. So it's also something that deals with that. So you have to try as much as possible to put off the screen at least 1 hour before you go to bed. It also assists with all of that.
Okay.
And then there's a rule we call 20-20-20 rule. When you're doing near work, your muscles are actually contracted. When you're busy with your screen or your phone or gadgets of about this distance, your muscles are contracted. Just imagine you carrying a heavy load with your hand for hours. And then you're going to feel, your muscles in your hands will feel stressed and strained. Therefore, if you're also using your system for a prolonged period of time, the muscles in the eye get contracted, and the long run could lead to muscle spasm and strain and all of that. So I advise you do the 20-20-20 rule. For every 20 minutes you spend on your system, you look 20 feet away. 20 feet is equivalent to 6 meters. So if you look up to 6 meters away, your eye muscles will get relaxed. And then you look at that 20 feet for a period of 20 seconds. So that will also help. Then the general advice is also that they feed healthy, take enough water, stay hydrated, eat a lot of vegetables, and just feed healthy generally to help.
Okay, so over to you, the photographer, guilty as charged. Okay, so can you tell us and the audience what you actually do that that can damage your eye?
I really put my eye on the screen without my lenses. Like, very, very close. I don't do the 20-20-20 rule. I'm always stuck there for hours. And once I finish, I do have migraines, serious migraines. So I will just carry water. I'll just carry water, put on my head. Like part of relief before I sleep.
And so you can still edit. So she will shout. So she will put the water on her forehead and then continue editing with the water on her forehead so that the migraine can at least calm down while her eyes are still fixed on the screen. Okay, I'm sure other photographers are also guilty as charged. Please, there is a 20-20 rule. 20-20-20 rule. Please endeavor to do that rule. Okay, there's another question that goes this way, and I'm sure that photographer on this podcast that is watching this podcast will be very, very interested in this one. You know, the body, we are expected to like sleep for at least 8 hours so that our body can rest. Yes. Now, if a photographer works for 18 hours, let's say works till 3 a.m. in the morning and sleeps by that 3 till and wakes up by 7. I know human beings, photographers or not, we can do that a whole lot. But if a photographer does that, does the eye rest within those hours that he slept? Or is the photographer carrying that damage over to the next day?
Well, when you sleep, generally, your eyes will rest. But then, it's not advised, the rest is not enough, let me put it that way. It's not advisable to just be sleeping for just 4 hours or 5 hours in 24 hours. It could lead to a lot of things, even systemically. Prolonged stress, chronic stress can lead to hypertension and all of that. And then for the eyes, it could also lead to eye strain. So I would advise that every photographer should put rest as a priority. Try as much as possible to rest and on time. It's advisable to sleep around 11 p.m. The body actually needs rest from that time of the day. So it's advised just try as much as possible to balance things up so that you sleep on time. It will help your eye, even your body will thank you.
Okay. So you said something about sleeping by 11. I hope that you can sleep by 11. You know, even when you are editing, you have so much work to do. Can you try to sleep by 11? People who carry their eyes like this, they squint a whole lot. Like any small light, you know, even without being a photographer, if you just open the window in the house, maybe you've been in a dark room and most importantly, the thing is, photographers edit in the dark. Am I lying?
No, it's not advisable.
They edit in the dark. Like the light is not on. They just them and the laptop. And then their eyes, they're not like sitting far away from the laptop. They are close and close and close. I don't know whether they are trying to edit the pimple on the client's face. So they move very close and then the room is dark and they're all. So when once they now come out of that room to the real world, they're not doing like this. What could be the problem?
Okay, actually,
is it like a disease or something?
Okay, I'll come to that. I'll start by saying that photographers should adjust the room lighting to be almost similar to the screen light so that there will be uniformity. That will also help with the eyes. And then people who squint and people who are light sensitive, those are symptoms of what we call refractive errors. More like, that's why there is need for you to be doing routine eye checkups from time to time. When I mean refractive errors, I mean eye conditions that require a pair of lenses. And of course, a photographer would need a blue cut pair of lenses to help trap light from the gadgets and even the harmful sunlight. So examples of refractive errors include myopia, that's short-sightedness, hyperopia, which is the long-sightedness, astigmatism. Then for older patients, we talk about presbyopia and all. Some patients can have a combination of two, myopia and hyperopia. Most times it could be myopia and hyperopia on the other eye, myopia and astigmatism and all. But then it's not a problem. With the correct pair of lenses, the patient will be fine.
Okay.
The squinting will no longer take place. And then the lenses will help with the light. So when you're exposed to light like that, you will not feel uncomfortable.
Okay, so in essence, what I've gotten there is that every person that owns a laptop and uses a laptop very often needs to have the blue glasses, the lenses on.
Yeah, blue cut lenses.
So it's a must.
Yes, to help with the health of the eye.
It's a must.
It's a must.
Okay, thank you very much. So, ma'am, please, can you tell us, are you wearing a lenses or just a random glasses? And why are you wearing a lenses?
Okay, this is a lens, actually. I can't even wear normal glasses. I can't, it doesn't work. I cannot walk under the sun without this, because it's more like a shade under the sun for me. Yeah, so even the blue cut, I don't know, I don't just...
Okay.
Yeah.
So, ma, please, can I ask this question for myself? For example, like me now that is not squinting.
Okay.
I'm not using laptop very often. My phone, I'm very mindful of my screen time. Is it possible that I can just be walking like this and then I have an eye defect or something?
Well, you would not know until you check.
Okay, so I have to check. But everything, I can see very far. I can see close. I can see around.
Until you check.
So I have to go and check.
Yes, of course. You have to go to visit an eye clinic and have your eyes examined. Some degrees of refractive errors are symptomless. The patient will see far, the patient will see near, but then there are very mild degrees of refractive errors that need to be handled. So most of the time it's like that.
Okay. Let's talk about this migraines that actually come directly to the eye that she talked about.
Okay.
What causes that?
Most times refractive errors and stress, eye strain. Most times it's refractive errors. When you get your lenses updated, ideally those migraines are meant to be taken care of.
Okay, so if a photographer damages his or her eye, what will happen to the person's career? And also, if it comes to wearing lenses like just put on the glasses, is it allowed to remove the glasses, take a picture or take pictures, and then when you're done, you now put it back? What happens? Are you damaging your eye the more by removing the glasses? Or is it a must to put the glasses on and then you can use your camera with the glasses?
Well, it depends on the degree of the error, of the refractive error.
Okay.
For those mild cases like that, I would suggest that if the patient feels comfortable to snap like that. But then if the degree of the error is high and the vision will not be clear for the distance at which the photographer will be snapping the picture, it's advised to make use of your lenses.
Okay.
Like when I'm shooting under the sun, since my glasses is more like a shade under the sun and I'm shooting with the camera, I get to remove the lens, or I do like this because it's dark. Vision may not be so clear. Yes, it's dark. Or maybe people that can't see with the camera, even when they're wearing their lenses, just want to remove it and be comfortable so they see different. Well, myopes are comfortable with near work. More like if they are doing anything close to them, they are very comfortable, their eyes are relaxed. Their problem is when they are doing things far away. So I understand the myope in that condition trying to take off the lens to handle the near work. But for your glasses, we have some lenses that do not really shade under the sun. but they are anti-reflective. More like they trap the harmful sunlight but do not shade. So those type of lenses may help you. When you wear it, you're able to snap your pictures under the sun, and you also feel comfortable under the sun.
Sorry, there was a question you did not answer. If you're a photographer, something happens to your eyes, it may affect your career.
Of course.
Hey.
To affect your career. And I want to add that there are some eye conditions that are symptomless. They steal your vision without you knowing. That's why you hear this person was seen yesterday, but the person is not seen again tomorrow, because there's some eye conditions that are very symptomless, and then they're capable of making you go blind, and such blindness cannot be recovered. So the role of routine eye checkups cannot be overemphasized. So as a photographer, you should try to be checking your eyes as often as possible. It will help.
Okay, that's okay. So please, so that you will not stop your career, please try to handle your eye issues. Okay, so at what point does the eye stop bouncing back?
Just come again. I don't understand.
At what point, let's say you've had this issue, you've had signs, and you've refused to go for eye checkup, and then you either take it to church for prayers and counseling, and you do fasting and hoping that God will heal. I'm not saying God cannot heal, God can heal, but that's when God placed doctors in their various fields. So you've done this over and over and over again. At what point does this person actually goes for checkup and the doctor says, I'm sorry, there's nothing I can actually do? So that's where I'm coming from. At what point does the eye stops bouncing back?
It depends on the challenge. There are 1,001 eye conditions. For refractive errors, like I said earlier, errors that need lenses to handle. There's what we call amblyopia, lazy eyes, in layman terms. Amblyopia has to do with a condition whereby a patient is meant to see up to a certain distance with a pair of lenses, but then the lenses can no longer take the patient to that distance because the patient has not been putting on the person's corrective lenses. So the patient can have amblyopia, and then some other conditions, like I said, can lead to blindness without the patient knowing. So it's good for you to run to an eye clinic at every slightest symptom you experience, so that it doesn't get too late.
Okay, thank you very much. Okay, from what was said today, Ma, can you generalize everything and speak to your fellow photographers generally, and you can also add your little experience to that. Thank you.
Okay. So this is me to you. You're a photographer out there, creatives, because it's not just photographers that deal with laptops and anything screenable. Other creatives out there. I know we usually talk about the things we do in the industry. Talk about cameras, we talk about editing, we talk about lenses and every other thing, money, client, but we usually don't talk about the body that does the work. So I brought this podcast to you so that we get to develop, we get to stand up and be aware of things that we are doing and we don't know that we are doing. So photographers out there that really have eye problem, I suggest you go to the hospital and get to test your eye. And if you don't have an eye problem, according to yourself, you don't have an eye problem, just try to avoid things that bring problems to your eye. Don't stress yourself too much. There was a time I could not really read. I could not rest, even go outside under the sun. It was very hard. I'll be squinting, just like she said. I'll be doing like this because of the ray of light from outside. So until I came to my doctor and I was able to get a lens to, fit in for me to be able to be comfortable. So it's a very, very bad experience. Please take your eye seriously, just like you take your craft seriously.
Okay. Thank you very much, Ma. Okay, Ma, I have one more important question for the creative. This is for them, probably for me too. what are the things that I know you made mention of water, resting. Are they like little multivitamins, drugs, tablets, like very little things that one must do, like creative must take in to help with the eye health?
Okay, I won't recommend medications, but then medications can only be recommended in the hospital when there is need. But my major advice is routine eye checkups at least once every year. And secondly, you have to feed healthy. Take a lot of protein, take a lot of fish, take a lot of vegetables, carrots, fruits and vegetables generally. It will actually help.
Okay.
How about those that don't like fish?
Just take protein.
Meat.
Protein.
Take eggs. Take
All of
eggs,
that.
please. Okay, so she said take fruits. They said regular checkup, and she said at least once. I'm sure once a year is not that bad. Once a year is not that bad, even if it's twice a year. But once a year is not that bad. Please take out time to check your health, your eye health, and make sure that everything is safe for you to continue working. So, Ma, generally, what can you say to the creatives as we're closing?
Okay, I really had a nice time with you guys. Thank you for everything, and I'm sure that you guys will really do well in your profession.
Okay, thank you.